We'll have to see what Sumia's commentary was, but I suspect it was an answer to probably a question about how long could this last, as opposed to how long do you predict it will last. We have a new virus entering the human population for the first time, and therefore it is very hard to predict when we will prevail over it. What is clear, and I think maybe what Sumia may have been alluding to, is that the current seroprevalence, or the current number of people in our population who've been infected, is actually relatively low. And if you're a scientist and you project forward in the absence of a vaccine and you try and calculate how long is it going to take for enough people to become infected so that this disease settles into an endemic phase, and we may never, and I think it's important to put this on the table. This virus may become just another endemic virus in our communities, and this virus may never go away. HIV has not gone away, but we've come to terms with the virus, and we have found the therapies, and we've found the prevention methods, and people don't feel as scared as they did before, and we're offering life to people with HIV, long, healthy lives to people with HIV. And I'm not comparing the two diseases, but I think it is important that we're realistic, and I don't think anyone can predict when or if this disease will disappear. We do have one great hope. If we do find a highly effective vaccine that we can distribute to everyone who needs it in the world, we may have a shot at eliminating this virus. But that vaccine will have to be available. It'll have to be highly effective. It will have to be made available to everyone, and we will have to use it. Before we began responding to this event on the 31st of December, we were heavily involved and had teams in the Western Pacific working on measles. At that time, every single ventilator, and we've learned about ventilators, all of us around the world in the last, a lot of people talk about ventilators. I think there were 14 ventilators in Western Samoa at that time, and all 14 were occupied by young children. And they were occupied by young children who had a devastating disease. It was called measles, and they weren't vaccinated against that disease. So forgive me if I'm cynical, but we have some perfectly effective vaccines on this planet that we have not used effectively for diseases we could eliminate and eradicate, and we haven't done it. We've lacked the will, we've lacked the determination to invest in health systems to deliver that. We've lacked the capacity to sustain primary health care at the front end. And therefore, science can come up with the vaccine, but someone's got to make it, and we've got to make enough of it that everyone can get a dose of it, and we've got to be able to deliver that, and people have got to want to take that vaccine. Every single one of those steps is fraught with challenges. It's a massive opportunity for the world. The idea that a new disease could emerge, cause a pandemic, and we could, with a massive moonshot, find a vaccine and give that to everyone who needs it and stop this disease in its tracks, will turn maybe what has been a tragic pandemic into a beacon of hope for the future of our planet and the way we care for our citizens and the way we work together to solve our problems, through solidarity, through trust, through working together, and through a multilateral system that can actually benefit mankind. So I think there are no promises in this, and there are no dates. This disease may settle into a long-term problem. It may not be. In some senses, we have control over that future, but it's going to take a massive effort to do it. The DG's been calling for it. He's been speaking, bringing leaders together, trying to drive the issue so that we have access to COVID tools. We believe we have a coalition that can deliver on that, but it's going to need the political, the financial, the operational, the technical, and the community support to be a success.